The heart is actually pacemaking the brain because the heart rhythm is about 1,000 times stronger than the rhythms that we see in the brain.
The electrical rhythm.
Yeah.
Hey there, seekers. Before we get into today's episode, I've got a small favor that could make a huge difference. If you find value here and think others could benefit too, the best way to help spread the word is to scroll down and leave us a quick review, whether you're on Spotify, Apple Podcasts, or YouTube. It only takes a moment and it helps us reach more people striving to unlock their potential. Plus, you might even get some good karma. Welcome to The Self You Seek, a podcast dedicated to helping you unlock your fullest potential through self-actualization, mental optimization, and transformative experiences. I'm Dr. Brendan Doherty, a traditionally trained psychiatrist who has come to realize that while psychiatry offers powerful tools, there's often something more needed to help people truly thrive. In this podcast, we'll explore evidence-based approaches alongside ancient wisdom and modern transformative experiences that push beyond the boundaries of conventional mental health care. Whether grounded in science or supported by compelling anecdotal evidence, these insights and discussions are all worthy of exploration. Join me as we navigate the path towards unlocking your potential and transforming your well-being. And a quick reminder, this podcast is for informational purposes only and does not substitute for personalized medical advice. Always consult with a licensed healthcare or mental health professional if you're uncertain or need guidance. This podcast also does not represent the views of any business or health service I'm associated with. And now for the show. Okay, welcome to this latest episode of The Self You Seek on Neurofeedback with Dr. Moshe Perl. Dr. Moshe Perl received his PhD in clinical psychology from the University of North Texas in 1983 and has been in practice since that time in the United States until 1992 and since then in Melbourne, Australia. His practice has involved both clinical and forensic applications and for many years consulted to the Children's Court in Melbourne. In 1998, he began his work with Neurofeedback, that is, Biofeedback of EEG or brainwaves, working initially with children with ADHD, but quickly expanding his practice to successfully help clients with adult ADHD, autistic spectrum disorders, anxiety, PTSD, chronic pain, and acquired brain injury, among others. Dr. Perl has been teaching neurofeedback and EEG analysis for over 20 years. He continues to teach seminars and has an online presence on his website, neurotherapy.com.au, and he can be contacted at info@neurotherapy.com.au. Welcome, Dr. Perl. It's great to have you here. I was really fascinated to experience neurofeedback recently and an EEG reading. And just as by way of introduction, as a psychiatrist who didn't get a whole lot of training in neurofeedback, I'd always known it, but it'd been a little bit peripheral. And so I wasn't quite sure of the evidence behind it. But to see it in action and to participate in it was really incredible. And I'm kind of interested about it from that perspective because I was really impressed by that reading on the EEG. It's almost like a really accurate horoscope or something about oh my goodness, that is me, that is me, that is me. It was really impressive. And so thank you for coming on. And it's fair to say you have a world of experience here. So we're looking forward to tapping into that today. I'd love to just start by, who is neurofeedback for? Yeah.
I think that when you talk about neurofeedback or biofeedback generally, you're talking about getting the person to monitor what's going on with themselves and then finding a way to improve it. And what's interesting is that there's a whole theory about that called adaptive systems theory, which basically says that all living creatures move to better adaptation every chance they get. And biofeedback is just one of those things. I mean, you imagine a little child learning how to stand up. I mean, look how many repetitions they do before they actually stand up. I mean, thousands. How do they learn how to walk? Repetitions. And it's actually feedback. They're basically getting feedback. And when the feedback is fast enough for them to actually control their muscles, they start walking. So biofeedback is something that's completely normal. That's what we do all the time. And all we use is instruments to extend our senses into places where we don't normally notice. One of the most interesting areas to me is muscles. Many people come in with very tense muscles, not to me necessarily, but to a practitioner. And, You can become aware of the muscles by doing a massage, or you can actually put a sensor on them and measure the electrical activity. And once you can see it, once you can experience it, you can actually change it. So biofeedback is just a way of noticing what's going on internally and then allowing it to shift. And with neurofeedback, it's just a subset really of, we're actually looking at electrical activity in the brain. And if you can actually see it, so the sensors that we attach to people basically show them. And then we say, well, here are some guidelines, you'll get beeps when your brainwave pattern is moving in the direction that we think is good. And when that happens, people start improving. And what we've seen, the biggest area where neurofeedback's been helpful really is focus, attention, and impulse control, ADHD type stuff. That was the biggest area that grew right from the start. It wasn't actually the first thing that they actually did, but very quickly they discovered that. And for me, if somebody were to come to me with symptoms of ADHD, issues with attention span, issues with impulse control, to me, it's over. We're going to be able to, and that's my experience. I would say better than 90%. Then neurofeedback's also used for peak performance. There are people who just work with peak performers and use neurofeedback as part of their strategy. And if you can take the edge off the impulses so that people don't overreact, and if you can calm a little bit of the performance anxiety, you can see that these folks who are already very good at what they do can do just a little bit better. And that's exactly how they integrate it. So neurofeedback is just a way of improving functioning.
Great to hear. And I just want to get sort of the evidence stuff out of the way, because I want to delve into, what is optimal brain state and, how it actually works. But let's just talk about that. My awareness of neurofeedback is that it probably works in ADHD, but it has been thought of as more of a peripheral type of therapy, at least in the circles that I've been. And it does work potentially for epilepsy, but for other things, there's less robust evidence. But please just speak to this idea of evidence, because I've heard what you said. You said, if someone has it 90% of the time, you can make a difference. That's pretty compelling. But talk to the naysayers.
Since I've been teaching this stuff for years, people would say to me, well, there's really no evidence that neurofeedback works. And then the particular way of doing neurofeedback, because there are varieties of ways of doing neurofeedback, people tell me, what you're doing is old hat. It's, there are better ways, et cetera, et cetera. And it just annoyed me, because I'm teaching this stuff. So I said, you know what? My son and I got together, and he was working with me at that time. We just reviewed all the studies we could find on neurofeedback. And this was in 2018. And we found something like 320 studies that were actually published in peer-reviewed journals. Not theoretical studies. These were actually studies with clients that, with subjects, they did stuff and they looked at the outcomes. And we just reviewed them. And the majority certainly were ADHD type studies. There were quite a few on anxiety, some on depression. PTSD has come into more focus as time has gone by. If we're going back to the late 70s, early 80s, when we started looking at studies, PTSD had not really sort of differentiated that clearly even then. It's become more and more clear now, and we understand a lot more about trauma now that we've understood previously. And we looked at studies that deal with anxiety in adults and trauma and found pretty clear evidence that it works. Now, when you look at randomized controlled trial studies, probably the most studies that have been done that are randomized controlled trials are in the area of ADHD, something like 60 studies. Well, how many RCTs do you need before you're convinced?
And they're all positive, I'm guessing, by that assumption.
Yeah, 95% of the studies that we reviewed were positive. And I would say that if people actually get decent training in what they're doing, they're going to find success with ADHD. Now, once you start getting into things like trauma, especially developmental trauma, what you're going to see is that there's anxiety, there's emotional breakdown, there's chronic pain, there's all sorts of other issues that are really severe, fibromyalgia, all these sorts of stuff that come up as a result of trauma. And so I wouldn't say that neurofeedback is the cure under those instances. What I'd say is use it as part of a team approach to basically lower anxiety so that you can actually do the trauma work, because sitting in front of a machine is not going to cure somebody of trauma. Trauma gets cured through relationship, reparative relationship. But if a person's not available because they're too anxious, and they just go into dissociation so quickly, you're not going to be able to work with them. And that's one of the major growth areas of neurofeedback now is work with trauma.
So in a sense, the neurofeedback brings the brain into a state that it's ready to address the trauma potentially. In a way, preparing the plate to be sort of digested.
Yeah. But nobody would say that, oh, yes, the neurofeedback is the cure.
I see.
No,
yeah.
Not a chance.
And that's what you're saying as well.
Yeah. When you can lower anxiety enough for people to actually start being able to work, then, those are very severe dysfunctional cases. We're not talking just simple stuff. One-off traumas, the expert on all of this, a guy by the name of Bessel van der Kolk, he just says, look, one-off traumas for teens or young adults, he says, probably is the best. And he shows evidence for it. But he said developmental trauma, probably not. And again, you've got a differentiation here. The other areas where I've seen neurofeedback really have impact are people with acquired brain injury. The prevailing wisdom is that after about a year of rehab, that's about it. There may be, every now and again, there may be somebody that after a year, bang, really has spontaneous recovery. But the likelihood is really low. So I've worked with people that had car accidents 30, 40 years previously. Yeah.
Potentially inducing some sort of neuroplasticity. Is that what you're thinking?
Well, the brain gets stuck in a particular place and then just adapts. And that's it. And basically the brain can sometimes idle areas that were injured. And that's it. They just keep idling them. And so when you do neurofeedback, you can actually bring those areas back. Now, if somebody's had severe brain injury and there's been death of brain tissue, well, not really. If people have had a stroke on the left side of their brain, I work with a few people like this. A lawyer, been practicing for a long time, he had a stroke on the left side of his brain. And we were able to help him with his attention, his impulse control, his mood regulation. We were able to help with that. We were only able to help a little bit with language. He was not going to be able to resume his role as a lawyer. Lawyers are just experts in language. They are so good at it, right? And that was very frustrating for him. But yeah, we were able to bring a certain amount back, but not all of it. In another instance, there was a guy who had a brain injury. He was not allowed to manage his own affairs because of this injury. He reached a point where he was able to convince the court that he was able to manage his own affairs and was then able to go back to his job. And I think he was a lawyer. I don't know how much law he began to practice after that, but he was certainly able to regain control over his life. And not just because the court allowed it, but because it was clear. And I did not do the assessment for the court. Somebody else did that. So yeah, there are things like that where the traditional methods of rehab are great. All of those things are really useful, but often there's a limit and neurofeedback can actually help move. So I would say that with acquired brain injuries, neurofeedback should just be used as part of the treatment.
Okay. So, and maybe we'll get into this later, but it's probably pretty low risk as well. In terms of the cognitive improvement, or what we'd call like improving peak performance training or something like that, where we're going from a baseline to improving that as opposed to a place of dysfunction, is the evidence for that based on studies, or is it more anecdote, or where does that come from?
Well, you have to understand that in the area of peak performance, the people who are doing it are not going to let the cat out of the bag, because that's money.
Yeah.
And they're not going to tell you exactly what they're doing. That's all there is to it. So there's going to be no published research on it. I mean, very little. And when you talk to them, they're just going to tell you, well, yeah, we can succeed with this and this. And they'll say, look, if you twist their arm, they might tell you about some of the folks, or get some of the folks that they've worked with to speak with you. But again, they're very protective of what they do. There's evidence that the Italian soccer team that won the World Cup in probably 2006 was using neurofeedback.
Really?
But again, they're not going to make a big splash about it, because they don't want anybody else to know what they're doing.
So is this all the clinicians that have neurofeedback machine just start to do it to themselves and then realize, holy crap, this is amazing?
Yeah, I mean, look, you start seeing the results, and many people get into it because they have either themselves and they need to regulate themselves. More often it's one of their children that they need to help. And so they get into it, and they actually start working with their own kids. And then they realize, that, oh, this is really useful. And being clinicians themselves, they actually then start using it in their practices. That's probably the most common way people get into it.
And do you work with people in the peak performance industry yourself?
I've worked with a few, not many. You have to know how to sell. You have to be able to swim in those sorts of waters where you can do very slick presentations. And I've got no issue with it, but that's that realm. And
Nice.
yeah, I don't have the personality for it, I don't think.
Okay.
Yeah.
I guess I'm just wondering that if it's really good, then wouldn't it kind of sell itself? And I know you're saying that people are going to keep quiet about it, but one peak performer talks to his best mate, peak performer, and says, "Oh, go find, a top practitioner and go try this."
Yeah, I guess I can give you the name of somebody in the United States. You can get in touch with him. And he runs a very successful peak performance business, and he's also using neurofeedback, along with a lot of other stuff.
Okay.
And he's a past president of the International Society for Neurofeedback Practitioners in the States. In other words, he's a really solid individual, but that's his area. And yeah, very interesting guy.
Yeah.
So yeah, there are folks that are doing it.
Okay. And apparently successfully. Okay. Well, let's kind of put that aside and let's get into brainwaves and what they are, and, just as a description. And what is an ideal, brain state? What are we trying to achieve? Because, and maybe as part of that, we can talk about the different types of brain waves. But it was kind of curious to me when I tried it that the idea was to be more for me anyway, more alpha brain waves.
Okay.
But I know that might not be the same for everyone. And who's to say that, why is calm, focused attention really good? What's bad about the other things? Yeah.
Okay. The first thing I say to folks when they come in to see me, because there's always a question, I'm going to put something here, I'm going to look at a screen, and then I'm going to get better, or my child is going to get better. Doesn't make any sense, right? I mean, it's not something that we're used to. So I say, look, everything that you see, hear, touch, taste, and smell gets turned into electricity to go into the brain. The brain's an electrical processor. That's it. And so if you think about your vision, you think about your eyes. Well, we know that the retinas turn light into electricity. We know that. That's their job. And then you go, okay, so then we know that there are these nerves that take this electrical activity somehow and move it to the very back of the head where it gets registered. And then it gets broken apart and then put back together, sort of not to the very back, but just above that, into some picture of the world.
Mm.
Okay. Then from there, it has to go to another part of the brain that's got to compare it to what we know already. Because you can't understand anything unless you can compare it to what you already know. Right? So you can't understand something. I'm seeing something, but I can only understand it if I can compare it to the memory of something that I already have. Oh, but that's not the end of the story either, because then it has to go somewhere in the front of the brain where we decide what we're going to do about it. So we take a picture here. It goes to the back of the head, gets broken down, reintegrated. We get a picture. Then it has to go out here to the sides, temporal areas, where it gets compared to what we know, so we can understand it. And then it has to go to the front where we decide what we're going to do about it.
Mm.
Okay. This is all electricity, and it happens about 10 times a second. Right? Because we don't take one picture in the morning and that's the end of it. I mean, this is a movie.
It's remarkable, really, isn't it? Yeah, when you describe it like that. Yeah.
10 times a second, more or less.
It's a fast
So
processor.
the brain has to have a way of moving information, electrical information, reliably 10 times a second. How does it do it? How does the brain move this information? It's not little guys in wheelbarrows moving this stuff from down to, these pathways. That's not how it works. The answer is electrical waves. That's what the brain produces in order to move information. So another example I give.
And sorry, the waves that we see are just the overall collection of the individual electrical impulses going down the millions or billions of neurons that we have, right? And it's just, we see it as a collection of that represents itself in one wave.
Yeah. I'll elaborate.
Please.
An analogy is like a surfer on a wave. The surfer catches the wave and the wave carries the surfer, right, back to shore. The wave is the carrier and the surfer is the information. That's what's going on. Except in the brain, it's not just going in one direction. It goes from here to here, then another wave carries it from here to here, and another wave moves it here, and another wave. In other words, it's being moved around, and it's coordinated, and it's very precise from a timing point of view. And the research that's done on how this information moves in the brain indicates the precision is down to milliseconds. Even less than that probably, but at least down to milliseconds. It's like going to Tokyo Central Station. If you've never been there, I mean, I live in Melbourne, so the biggest station we have is, what do they call it? Southern Cross Station, and I call it Spencer Street Station. There might be 24 platforms. Okay, imagine that in Tokyo, you've got 24 platforms on 7 levels. That's how big that station is. And from about 5 in the morning till about 11 at night, there are just millions of people. And I would say that's an interesting analogy to what goes on in our brain. In other words, that bit of information has to get to the right level, to the right platform, at the right moment to catch the train. If the person is early, they miss the train. If they're late, they miss the train. They've got to get there at just the right moment. That's the sort of timing that they found exists in the brain. So these waves have to be very clearly coordinated. And the fact is that our brains don't lose much information. They're pretty good. They're not like computers. It's very unusual that you have to reset a brain.
Psychiatrists do it sometimes.
Yeah, but I mean, it's not a usual thing. In other words, our brains are they've got a lot of redundancy built into them. Lots and lots of redundancy. And so it takes a lot for the brain to have to reboot, right? It takes a lot for that to have to happen. And so this system of movement of information is very reliable and very accurate. And of course, there are quirks. Sure, one person's a bit this way, one person's a bit this way, etc. Obviously, if somebody gets whacked in the head, it's going to do something to that. It'll affect the area, but it could also affect the central mechanisms that are actually regulating how all of this is supposed to work. So we have to have a way of moving this information, and waves are the way we do it. And the quality of the information is often determined by the carrier. In other words, emotional information is often carried by slightly slower waves. If you want the name, theta, some alpha. If we're highly focused, we tend to have more faster wave, beta. And we can see that the dominance of a particular waveform really is a pretty good indicator of what's going on in the brain. I mean, it's not absolute, but it's not bad. And, when I was interpreting the EEG that you produced, that's exactly what I was doing. I was saying, well, look, these are the sorts of things that you would imagine would happen with this sort of wave, right? And you can see that, you get a lot of hits. And the thing is that brainwave patterns are not diagnostic, except for epilepsy. That's one of the reasons why medicine left EEG. It abandoned EEG in the 60s. Once psychiatry had figured out lithium for bipolar disorder, antipsychotics for schizophrenia, they were sitting pretty, because those were the two biggest issues that psychiatry had to deal with in the 50s and 60s. And it was a huge revolution in psychiatry. I mean, no question about it. And so EEG was abandoned. And
for all but
epilepsy.
Testing if the symptoms are caused by epilepsy.
Yeah.
Yeah.
I mean, you will get neurologists that'll look at people who come in to hospitals with organ failure, because there's an effect on brain function, and there are very specific brainwave patterns that'll occur. So, the specialist physician will often want to know, okay, how impaired is brain function as a result of what's going on with the organ failure? And the neurologist they can give a pretty good picture, and that's EEG stuff. So not just epilepsy, but it's a very limited scope. And I would say that there was a guy in Sydney who would do EEGs on people, and then he would write to the specialist physicians who sent him their patients, and he would tell them what classes of medication were most likely to be helpful and which classes would probably not be very helpful given their EEG.
Okay.
And he made a living doing that.
Wow.
And so that's a side piece where if somebody says to me, well, here's an EEG, what sorts of medications might be most helpful? Now, in psychiatry, I would say the critical pieces are, should it be a mood stabilizer, or should it be an antipsychotic? Or will an antidepressant do the job? Those are the three big tools, right?
It's true.
But EEG can help you determine that. And in pediatrics with ADHD,
has that been studied?
Well, what I would say is, talk to this GP in Sydney who's been making a living doing it.
And people trust them.
Well, they come back.
Yeah.
The specialist physicians are coming back. So I would say, no, well, the piece is that every medication that's put on the market has to have an EEG study, because, the Therapeutic Goods Administration, or the FDA in the United States, they don't want something that's going to cause epilepsy to come onto the market.
Right.
Right. So
and that
stuff is actually in the public domain. The effect of a medication on EEG is in the public domain. It's not secret. It's just a matter of looking at it and seeing it. And so my teachers of EEG had done that. And they said, these are the results. This is what we find. This is what this medication does, right? In pediatrics, I would say it's especially useful for ADHD, because if you look at the prescriptions of medication for ADHD, you'll see that probably 60 to 70% of them are going to be stimulants, and then about 10% are going to be mood stabilizers or anti-epileptic. I mean, that's really what they are, because the brain is actually unstable. but you don't know that beforehand. And if you did an EEG, even if you just measured one spot with eyes open, you'd be able to tell very quickly whether you wanted to use a Ritalin or Dex or whether you wanted to actually use something else.
I would say that's because they probably got the diagnosis wrong, right? Like the ADHD is probably actually mood dysregulation.
Maybe. But no, I mean, there are kids with ADHD that have come in to see me where the brainwave pattern, I mean, they're diagnosed ADHD and they've got the symptoms. I mean, that's one of the problems of the DSM too.
Right. It's got no construct validity. Yeah.
Well, it's a categorization of symptoms, not etiology. But to me, it's like, okay, so as far as it goes, it's okay, so long as we know we're talking about the same thing. Okay. But when it comes to treatment, you have to, to me, you'd want to know a bit more about it before you decide how you want to work with it. But again, yeah, I mean, some people get in the neurofeedback field, they go on and on about the DSM, blah, 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 and I go, well, it is what it is. It's behavior, understood as behavior. Sure, you got these symptoms. I think it runs into trouble sometimes when you've got somebody with severe developmental trauma and they're diagnosed with borderline personality disorder. And it sort of says, well, what you've got to deal with is trauma. So, that's stuff that I've seen. But psychiatrists are good at what they do.
Okay, so we have these basically readings from the EEG. And then, you've nicely described that there's, for instance, theta waves that are more emotionally based. There's delta waves. I don't think you mentioned, but, that's more sort of deep sleep. And then there's beta waves, it's just kind of like active problem solving, quite an activated type of brain. And then alpha is sort of more a relaxed, calm state. It can also be meditative. Yep. And typically in people with ADHD, are you wanting to bring in more alpha type brainwave activity or in peak performance?
Depends on their EEG.
Depends on their EEG. It's very personalized.
Well, the research suggests that about 30 to 40% of people that are diagnosed with ADHD have excess alpha. Some of them only have excess alpha. Some of them have excess alpha and excess slow wave.
Okay.
Theta and delta. They just did studies on it. And when you look at, which medications are most useful, the antidepressants tend to suppress alpha. So you see folks with ADHD who are inattentive and you look at their EEG and they've got too much alpha and you go, yeah, they're probably a bit anxious too. But it's probably not enough to say, oh yeah, they must be an alpha type. I couldn't tell just from their symptoms until I look at the EEG and say, oh, okay. I don't know how good the SSRIs especially are at ADHD with that signature. I just don't know. I don't know how successful the antidepressants are with people who just have excess alpha. It's a really tricky one. And it's a bit more tricky for neurofeedback too. But you see the positive side of having alpha. You see people who are immensely creative, who have excess alpha, like excess. They have a lot of alpha. And to me, it's like, well, yeah, it's just a different style. I don't call it a disorder. It's a style. So how do we encourage that creativity? Because heaven knows we need creativity in this world. But what you see when those sorts of folks come in, yes, they're creative, but they can't get the job finished. Mm-hmm. That's their issue. So to me, it's like, okay, I want them to be able to be creative, but I want them to be able to start and finish the work of art. Otherwise, they're going to be very poor. You've got to be able to get it done so you can sell the damn thing, so you can make a living.
That's it.
And so, there's a point at which, you have to see, okay, how can we work with this? But the person who has excess alpha and even excess theta, which is the most common pattern for ADHD, the very slow wave, many of them are very creative. And so you go, okay, how do we work with it?
Correct me if I'm wrong, but in hearing you describe this, it really sounds like the process of interpreting an EEG, first of all, takes a lot of experience. And it would be important to work with someone that has that experience, and you are making an interpretation on diagnostic elements to some degree. When it comes to, maybe some people would make a prediction on what type of medications would work for a person, this type of ADHD versus that type of ADHD. But that ultimately you make a hypothesis about this person, and then you create a tailored solution and try it out on them. And then you tinker as you go along. There's no one size fits all when it comes to neurofeedback. And that's the importance of working with someone that really knows what they're doing.
Yeah, that's my sense. In every field, you've got conveyor belt therapy. And it might work plus minus for, 60, 70%. I don't know. I'm just throwing out a number. That's not the way I like to work. I individualize. And when you individualize, you can see, my son would always describe it as the low-hanging fruit. Sure, there are ways of getting the low-hanging fruit.
Yeah.
But if you want to get better than that, but if I did nothing more than just put one sensor on people's head right there and train in one specific way with everybody, it didn't matter what they were, I'd probably get 70% success.
Okay.
Which, if that were a medication,
pretty good.
They
Excellent.
would go for it. It's really an interesting piece. And there are practitioners that really have that philosophy. They say, oh, look, all of this, you're doing, this and a bit of this. It's too much. Just one spot, just train them, and it's going to be okay.
And correct me if I'm wrong, there's also like over-the-counter type machines that you can buy off Amazon or something. You can do it to yourself, can't you? And I'm guessing that's the sort of conveyor belt model.
Well, yeah. The other part of doing that is, I think that if you do the basic stuff, you're not going to, you're just going to find it doesn't do much of anything. Does it have the potential to cause harm? Maybe. In my practice, how many, I don't know, I would have worked with thousands of people over the time I was in practice. How many had negative effects? And some of the autistic spectrum kids, if I activated them a little bit, would stay a bit activated for a couple of days afterwards, which was not fun for their parents. But they would come in and we would fix it up. I only had 2 people over my whole time where there was something a little bit more than that out of thousands. From my perspective, that's very safe. And the one case where there was a person who was just sensitive to everything, sensitive to chemicals, sensitive to foods, just sensitive to lights, their whole system. And we did a bit too much neurofeedback, and they were just for about 2 months. And I learned from that.
What do you mean by?
Oh, they just were having trouble functioning for about 2 months.
Yeah.
And it made me understand that if I ever work with somebody like that, I've got to be extremely careful, to do just the tiniest amounts of whatever it is that I'm doing. And then I found that was actually successful. That was better. So with other people that had that sort of sensitivity, I was able to work successfully. But so, that's not, but if
another reason to work with someone that's got experience, right?
Yeah, especially if you've got issues.
Yeah.
You get one of these machines on the web. If a person like that were to get a machine on the web and do something, they could do some damage to themselves.
So the most serious side effects are really around, is it a type of sedation or lethargy or just not being able to concentrate? Or is it worse than that? Or is it like they were just bedbound for 2 months?
If you've worked with people that have that level of sensitivity, right?
Yeah.
You see their history of how they're just non-functional for a period of time. Getting out of bed is difficult. Eating is difficult. Getting out of the house is difficult. Those sorts of things. Yeah, it pushed that person in that direction. They were functioning, but not very well. And it took about 2 months for them to recover, and we did no more neurofeedback.
Okay.
Yeah.
And the general types of side effects that you would warn people of if they were to engage in a session, what would that be?
Oh, well, certainly if it was an individual who had sensitivity, and I developed a checklist for sensitivities, and I just said, okay, let's have a look. And I was very careful, and everybody that I taught from that point on, I just said, look, err on the side of caution, because you don't want that to happen. And if you find that, no, they're fine with, 1 minute of neurofeedback. Okay, then you can slowly increase it and see how it works for them. But yeah, so there's a group of people where even with medications, they have to take tiny amounts, because if they take more than a tiny amount, they're
Absolutely.
just wiped out. Anyway, that's what those folks told me. So
Okay. But just generally, like, are people getting, after a session, do they get headaches? Do they get sleepy? Do they get wired? Like, is there any?
well, you can do all of those things in a session depending on where they are, but you're always checking. You're careful, and the biggest dimension that neurofeedback works on is, what would I call it? Energy level, taken broadly. In other words, you can give people a bit more energy, or you can calm them down. And, with attention and focus, it's a very similar dimension. You can make their attention get sharper and sharper, or you can just sort of settle them down. It's like giving them a couple of cups of coffee or giving them a glass of wine. I mean, that dimension is a dimension neurofeedback works on really well. And activation level is something that's a part of a lot of disorders. It's not always the only part of a disorder, but it's a big piece. If you've got somebody who's depressed and you basically give them some energy, their outlook may start changing because they can get stuff done and they can feel better about themselves. So that's an interesting piece. Somebody who just gets aggressive all the time. Not that they're going to come in for therapy, because usually for that sort of person, it's always somebody else's fault. Yeah. But if you get them in, you just go, let's settle this down a bit. I mean, that's especially true for ADHD impulsive kids. And all of a sudden, they can sit in class, they can get their work done. Not an issue.
Just in terms of the actual process, this is something that came up when I've only tried it one session, and I will share some photos on the sort of social media and stuff, just so people know what it looks like. And just going back to the idea of biofeedback. So often what it is, it's a game of some sort that positively responds when your brain's activated in the right way. And how does one know that it's the right way? Is it completely a subconscious process? Is it something you learn over time? And what is that? Yeah.
If you're talking about adults, and we'll take the simple paradigm, which is we say, look, let's say that this person has a little bit too much slow wave, which means that their focus is not as sharp as it could be. It's usually what happens. We go, okay. So what we're going to do is we're going to set up where we analyze the brainwave pattern, and we'll filter in the slow. So, okay, there's the slow part. And here we've got the part that's associated with good focus. And here's the part that might be associated down here. This might be associated with a bit of agitation or anxiety. And we say, okay, you know what? We're going to set guidance. So if you produce more than this amount of that slow, you won't be able to get a beep. If you produce more than this amount of the very fast, which might indicate anxiety, but you won't get a beep. And then here in the middle, we've got the one where we say, well, this is associated with good focus. So what we want is for you to produce more than the level we set. So we set the threshold. If you've got more than that, you can get a beep. So the logic is less than this one, and more than this one, and you can get a beep. Mm-hmm. And that's the feedback.
Okay.
Getting a beep.
Is that
getting a beep is the feedback.
I understand that's the feedback, but then how do you work to get more beeps?
Well, the thing is,
how do you consciously know what to do?
We do this with 3 and 4 year olds. Of course, you don't explain anything to them, and they train perfectly well. It's hilarious, right? Okay.
So it's almost like, is it like Pavlov's dog or something? Or like it's?
Oh yeah, it's conditioning.
Like it's conditioning. And you're not even realizing it's happening.
Yeah, it's just like, okay. I think that there's a lot more involved in conditioning than we would imagine anyway, but that's a discussion we might have. But the thing about it is that you don't have to tell the brain what to do. All you say is beeping's good, finished, done.
Give it a beep.
And, you
It
know,
makes it very simple.
this thing in here is a vacuum cleaner for information. And this is another thing I explain to clients. You know, this thing is so good at picking up information that we don't even notice it anymore. You know, you go to work and there's a bunch of people on the bus or the train or wherever you're going. Then you go to the bus, and then a week later you notice, oh, there's somebody there. I saw them last week. You might not know their name, but I saw them last week. Pattern recognition. Our brains are so good at pattern recognition. Now, human faces, we say, sure, we're probably wired to recognize faces, right? But nevertheless, we're damn good at it. So out of thousands of faces, we can pick a face we've seen before, right? That's what our brain does. We don't have to tell it to do it. It just does it.
Mm-hmm.
So we're giving it this information on a screen, right? And he goes, oh, yeah, I'm doing 1,000 things at the moment, so 1,002 doesn't make much difference. I can do that too. And it just does. And it picks up the patterns. And with most people, actually, it picks it up within one session, and people notice something happening even after one session.
Mm-hmm.
The brain has picked it up and is now reconfiguring something internally. I mean, which to me is astonishing. But why would we be astonished at this thing? I mean, this is what's built our whole cities. This is what sent rocket ships to the moon. I mean, this is an astonishing piece, isn't it? So it just does it. And people get hung up on that. How on earth? But I'm not doing anything. Well, no, consciously, or, you're not directing something somewhere. But the brain itself is always just sucking in information, processing it, doing something with it. I mean, that's the only way I can understand what happens, because we don't explain anything to little kids. And parents call me back the next day. I say, well, how did the kid do it? And they say, yeah, on the way home, they started answering my questions, telling me how school was,
mm-hmm.
Which they never do. It's like that was on the way home from the session. You start getting stuff like that. Now, it takes a while for that stuff to become more permanent. It's not like, oh, yeah, one session, it's done. But what you're seeing something start shifting very quickly. And I would say definitely for the majority of people, something starts shifting even after one session. If after 3 or 4 sessions something hasn't shifted, I'm going to change what I'm doing dramatically. I'm not going to go 30, 40 sessions. So, yeah, I mean, to me, it's a process that the brain gets hooked into very quickly.
Well, the brain loves rewards, right? So if you know that beep means something good, then
gets a direction.
Like
now, for little kids, looking at a fairly boring screen and beeps, it doesn't cut it. So if you want to work with kids, you have to get something that engages them.
Okay.
And so you use videos and stuff like that. And so the video goes darker or lighter.
Okay.
If their brainwave pattern is moving in the direction we want, and they just want to see the movie. That's their motivation. They just want to see the movie.
Yeah.
And it's funny because parents will come in and say, well, have you explained to my child what they're supposed to do? And I'll go, so I say to the kid, but it's irrelevant to the child. They just want to watch the movie.
The movie, yeah.
And if it goes dark, they're not happy. So, their brain is getting the information it needs.
I do love the simplicity of it. Yeah. Trust the process. Let it happen. Yeah.
And, biofeedback is a fundamental process. This is how we learn. Like I said, this little kid learning how to walk, learning how to stand up. It's fundamental. Feedback is fundamental to how we do pretty much everything. So all we're doing is extending your senses into some area where you wouldn't necessarily know. But as soon as the brain gets the information, it starts working with it.
I hear you. Trust the process. Yeah, absolutely.
Yeah.
The brain is remarkable. I'm going to ask you a 3-part question. I really like hearing the stories behind it and also thinking about the future of it. And I can remind you of these questions as we go. But the first one is, and I probably should have asked this before, when was neurofeedback developed and by who? The second one is, why did you become interested in neurofeedback? And the third one is, what do you see the future of neurofeedback being?
Okay. Well, neurofeedback, as we know it, this sort of methodology that you've seen that I'm talking about mainly, it was a guy who was researching cats. And NASA was, at this time, it's the late 60s, was worried about its astronauts, that one of the rocket fuels is so toxic that if you get some on your skin, it destroys your GABA inhibitory system in your body. And then you go into unending excitation, you have seizures and you die. I mean, it's really nasty stuff,
Wow.
right? Methylethylhydrazine. So anyway, they were worried that little bits of this methylethylhydrazine was actually getting into the cockpits and making the astronauts say and do weird things. So they said to this researcher, they said, look, you got some cats you've been doing research on. Just poison them and tell us what happens. We want to know what this stuff does, right? Because we're worried. So he did. No ethics committees back then. So he just did it. And one group of his cats just resisted the seizures. And he goes, that doesn't make any sense. They all had the same symptoms, all got the same symptoms but then one group just delayed getting seizures, and some of them never even got seizures and didn't die. And he went back and he looked at his records, and this was the group that he had actually trained to produce a particular rhythm in the brain.
Okay.
And so then he repeated it, the experiment. This time he used penicillin, because penicillin's not toxic if you get it on your skin, but high doses will induce seizure. And he got exactly the same result. And he published it, of course. And then he started working with people who were awaiting split brain surgery. And over a course of 10 or 15 years, he worked with hundreds of these very severe epileptics and saw dramatic improvements. And he published all of that. And that's published in the literature.
And for people, just the split brain surgery is a type of surgery that's used when you have intractable epilepsy and you actually need to take out and completely split the hemispheres of the brain so they can't communicate and create the epilepsy. Anyway.
So they stopped sending him people because they got off the wait list because they didn't want to have the surgery anymore.
No way.
So they wouldn't send him any more patients.
Wow.
He laughs about it. He says, yeah, that's what happened. But anyway, but he got enough to show that this stuff's making a difference. And from there, it moved into ADHD because there was a researcher. They saw that people with epilepsy also, some of them had impulse control issues, some of them had, all sorts of other stuff. And that also diminished. They slept better. There's all sorts of other things happening. So they said, oh, maybe it'll work for ADHD. So a guy started it in the late 70s, started working with ADHD, and then saw that it works with ADHD even if you don't have epilepsy. So that's how it started. And for me, I was at some psychotherapy training course, and one guy there was a psychiatrist, very much into nutritional medicine. Really interesting guy, great guy. And he looks at me one day and he says, it's 96 or 97 or something, and he says to me, you can work with these ADHD kids without medication. And I said, oh, yeah, pull the other leg. And he says, yeah, there's this guy in Sydney who's doing this biofeedback brainwave stuff. So I went up to Sydney and I saw what he was doing, and I thought, this is great, because I'd already worked a lot with ADHD kids before then. And there's not a lot about ADHD I don't know about, because I've worked with so many kids and worked in schools and looked at all the stuff that they're doing. And I would just send them off to pediatricians for medication, and medication was good. I would say about 2/3 of the cases, medication seemed to do okay. Not a lot of side effects. It's a pretty safe, the stimulants are pretty safe medications. They're not bad. So I go, okay. But anyway, as a psychologist, I can't prescribe medication. And, I say, well, maybe there's something I can do, rather than being a way station for them to get medication. And then medication sometimes doesn't work real well either. But usually those are much more complicated cases that the medications won't work. But the majority work fine because I follow these kids up in school. I saw how they were doing year after year. So I was watching these kids so I could see that when they're on meds, the meds worked. And sometimes there were some side effects. But anyway, so I went to Sydney and saw this guy and I said, great, I'm in. So I started working and I actually started seeing these kids change right from the start. So I knew nothing about neurofeedback except to just put these on and do this basic stuff, and they improved. So that's how I got into it, working with ADHD.
That's fascinating. Yeah, makes a lot of sense. Yeah, and you got the difficult patients. Yeah.
Well, I mean, we did a lot of work with autistic spectrum kids too, and that's a bit different because not only do they have the frontal lobe issues with executive function, right? They go round and round in circles, right? They become very obsessive about stuff. They've also got sensory integration problems. They get overloaded or they get sensitized to stuff, can't stand noises, all that sort of stuff. Their sensory system gets overloaded, and then they don't understand social interaction really well. They have trouble with that too. So that there's some sensory integration issues. So that's the difference. Is they may have some frontal lobe issues, which is executive, which is attention, focus, impulse control, but they've also got really a lot of problems with the incoming stuff. It just doesn't come in. They can't process it properly.
Yep.
So you got to do different sorts of work with those kids. But we did a lot of work with autistic spectrum kids too.
Fascinating. Thank you. And it's actually the story about the history of it makes me wonder about what do you see the future of neurofeedback being? Are there any, is it about getting it more mainstream, or are there some exciting developments, or
I think that the biggest area of growth for neurofeedback is going to be in the area of developmental trauma. Because even if you talk about ADHD, what are you talking about? You're talking about 3%, 5%. It's a fairly small number. It's big in terms of the number of people that suffer from it. But it's when you talk about developmental trauma, 20%, 30%, 40%, it's a huge number. And, as a society, humanity, we're busy creating more of it.
Unavoidable, really. Yeah, we can reduce it, but it's unavoidable. Yeah.
And you go, okay, that's the area to me where there's going to be growth. And the most interesting piece to me is that we can delineate 3 different bandwidths of neurofeedback. The first bandwidth is the thetas, the deltas, the alphas, the betas, all of those going from, say, 2 cycles, 2 hertz to 40, 50 hertz. Then you've got a range that's between probably 0 and 2, and it's not even a rhythmic stuff. It's basically how networks work in the brain. They switch themselves on and off. And that's fluctuations. But since we analyze fluctuations mathematically, we have to turn them into rhythms. But they're not rhythms, they're fluctuations. And there's work on, and very good research on working to help people train with those. And then there's another area that is much more recent, and that's looking at biological rhythms and how they affect the brain. And it's been known, biology people have known for 30, 40 years that gut rhythms, electrical rhythms affect the brain, that liver rhythms, that kidney rhythms, that intestinal rhythm, that the body is affecting the brain, and the health of the body gets reflected into the brain as well. And in trauma, there's a huge disruption, especially developmental trauma. And there's a whole new field looking at these rhythms that are, you call them rhythms, but it's like, it takes 100 seconds thing to complete, because that's the rhythm that's going on somewhere in the abdomen, and that's just one. There are these various rhythms that have got to do with replenishing cells with nutrients, with repairing cells, with taking out rubbish. That there's not a whole lot of research on that now, but that looks also really interesting. So, and especially for trauma, but I'm sure it's going to have other applications.
And I'm aware there's active research going on in terms of showing heart-brain coherence as well. Obviously, the brain rhythm one a second, and there's some of the.
Well, the question always comes down. I mean, I have to laugh at this. It's like, well, there's the brain. The intellect is, but we've got a pacemaker for the brain, don't we? And it's right here. And every second, oh, the heart, embedded in all of these sympathetic and parasympathetic ganglia, which, by the way, probably constitutes an emotional brain. That's according to Candace Pert, who should have gotten the Nobel Prize for discovering endorphins, but her major professor stole it. But anyway, very interesting that the heart is actually pacemaking the brain, because the heart rhythm is about 1,000 times stronger than the rhythms that we see in the brain.
The electrical rhythm.
Yeah. That, oh yeah. And yeah, it's just, I mean, to me, it's like, sure, the brain, oh yeah, the intellect. Come on, mate. Look at what's going on.
It's a bidirectional system, isn't it? The brain's sending things, obviously signals down to the body, and the body's sending signals to the brain, and it's all integrated. And obviously, these things are obvious to you, but, we feel emotions in our body.
Yeah.
And that's obviously a communication to the rest of the brain.
Yeah.
Or to the rest of the body, including the brain.
I'll never forget, I was speaking once to some guy, because I used to do martial arts, and this guy was from Korea, and he was into Taekwondo, young guy, and he wanted to go back to Korea. He was probably 18, 19 years old. And he wanted to go back to Korea, and he wanted to go to Taekwondo University. Imagine. Study. But anyway, when he said, I think, he pointed to his heart. It's very interesting. Because in the West we go, I think. And it's a very interesting piece, isn't it? That this, for many cultures, this is actually the center of the intellect, whereas we've separated it out.
Particularly in Western culture.
Yeah, it's just a curious piece. And here you are in Bali. You're right in the middle of it.
Absolutely. Yeah. No, we've had people talk about somatic therapies on here before, and it's big stuff, but there's an interesting parallel process. There's not much integration of what's happening in the brain and what's happening in the body. Like, people tend to be focused on feelings in the body, and people tend to be focused on logic and reasoning. And it's very hard sometimes, I think, for people to integrate it and to study it. But of course,
of course. Yeah, but all of a sudden, with these very slow rhythms that I'm talking about, it's like, we're starting to see, and I would say that's, there's going to be some really cool research coming out on that. I mean, and my hope, of course, is that the uptake of neurofeedback will continue, because I see it as a very positive piece and can be very helpful. And it is its own thing. It's not just like meditation or just like relaxation. Not that meditation and relaxation are bad. I mean, they're good in their own rights, but it's not the same as. It's a different piece. So it's very interesting to see how it might integrate.
Yeah. Gosh, there's a whole nother world we could talk about. Let's just finish maybe on one question. I think it's perhaps speaking to something of the future or what people are looking for. Have you noticed, or are there any links in neurofeedback that have helped people connect with something spiritual?
I've worked with people who have used forms of biofeedback to help settle themselves, as a precursor to meditative practice. And, to me, a person can have busy mind for a variety of reasons. It's just one issue. But of course, I've got a brain that doesn't stop. And so, you say, okay, to be able to sustain attention on something, to just be able to gently keep your attention on something. People who have issues like ADHD, I don't even want to call it that, but people who have some trouble with that, sometimes just settling the system a bit can allow you to just stay focused, not just on mundane day-to-day things, life issues, which is very important anyway, but also on inner practice. So yeah, there's probably something there. One of my colleagues went to Thich Nhat Hanh in France. I mean, Thich Nhat Hanh, I don't know if he's still living, but at the time he'd had a stroke. She took her neurofeedback equipment there. They were very interested in the neurofeedback, not just Thich Nhat Hanh, but other people there were very interested in it, just to look at it and to see what it is. Because anything that allows a person to enhance something in terms of their practice is useful.
It actually makes a lot of sense, because even if we talk about, so especially when we talk about ADHD, but also the sort of number around that where people have some difficulties with attention, and particularly in the modern world when we have all this distraction right in front of us, that it's always and it's continually taking our focus away from perhaps what's most important or perhaps what's deepest inside us. And one of the tricks is to be able to settle ourselves enough to be able to do that and remove that distraction and train our body to have that daily practice. So it does make a lot of sense that if you have a biofeedback that allows you to do that, to not get distracted and to turn internally, and that it would increase a spiritual practice and also help your life in many other ways.
I would say that spiritual practice is going to be tricky no matter what. I mean, just nature of the beast, isn't it?
Absolutely. So, I mean, it means something different to everyone. It's a Pandora's box. Yeah. It's used and abused and bypassed, of course. Yeah.
So, but neurofeedback's a really interesting, I would say it's an interesting tool.
Yeah. Well, clearly you've been doing it for 20 years, longer. But look, Dr. Moshe Perl, I super appreciate this conversation. It's been very enlightening to me, and I'm quite confident that the guests will enjoy it as well. So thank you so much for sharing all your expertise and wisdom.
I appreciate you taking the time to talk with me about this, and I hope that it's useful to some people.
I really think it will be. Yeah, thank you again.
Okay, my pleasure.
Thanks for tuning in to The Self You Seek. I hope today's episode brought you one step closer to unlocking your full potential. If you found value in this conversation, I'd love it if you could take a moment to rate and review the podcast on your platform of choice, whether it's Spotify, Apple Podcasts, or YouTube. Your feedback helps us grow and reach more people on their journey to self-actualization and mental optimization. And remember, this podcast is just the beginning. It's meant to inspire and empower you, but it's no substitute for personalized advice. If you ever need guidance, always reach out to a licensed healthcare or mental health professional who can support you on your unique path. Until next time, keep seeking, keep growing, and take care of yourself. I'll see you in the next episode.